In which following condition Gohn complex is most likely to be found? So it is direct question. That means the Gohn complex present in which of the pathological condition? Here the options are the actinomycetes, infection with Mycobacterium tuberculosis, which is the TB, mycosis fungoides, Lewy body dementia, chronic lymphocyte leukemia. So we have to find out the Gohn complex is found where of the place. So first of all, the pathology of the tuberculosis. So it is form of the primary chronic inflammation. That means when inflammation or when tuberculosis infection starts, it continues. It usually not breaks. That means it continues, and it is caused by the inability of the macrophage to kill the Mycobacterium tuberculosis. The Mycobacterium tuberculosis, it is a low metabolic activity organism. So for this condition, the macrophage usually it not possible for it to destroy the Mycobacterium tuberculosis. And what occurs when the macrophage engulfed the Mycobacterium tuberculosis? This macrophage migrated to the regional lymph node to represent it the other lymphocyte, and the lung lesion plus affected lymph node is referred to as Gohn complex. So this is the Gohn complex. So Gohn complex is present where? The Gohn complex present in the lungs. And what is the Gohn complex? There is lung infection plus lymph node involvement. So lung infection and also lymph node infection or involvement. In case of Mycobacterium tuberculosis, it is the Gohn complex. And it also leads to formation of the granuloma. So what is the role of the granuloma? Actually, the granuloma, it prevents the spread of the any infection. So there is presence of the caseating necrosis. So the information in this space is very, very important. And actually the tubercular pathology, the information is very, very similar, and all the lines, all the information is very important regarding the tuberculosis pathology. And what type of the inflammatory response here? It is the type 4, which is the delayed type of hypersensitivity developed. There are 3 important type of hypersensitivity, which is the type 1, 2, 3 and 4. But among them, the type 4 occurs in case of the tuberculosis. And in case of immunocompromise, that means where the immunity is low, in this condition the TB usually disseminated. That means it spread all the area of the body, all the lungs, all the area of the body. In this condition, it is known as the miliary TB. And diagnosis, it is diagnosis by GL Nielsen staining, but the definitive is the culture based, which is the most important, but it is requires the longer time. For this condition, usually we should depend on GL Nielsen staining, but nowadays it is possible to diagnosis by the gene expert within very short time and accurately time. And also there is in the gene expert machine, there is possibility to diagnosis also is it resistant to rifampicin, isoniazid or not. So the gene expert machine is a latest invention. And what is Gohn focus and Gohn complex? The Gohn focus is the primary infection, that means infection of the lungs. And what is Gohn complex? It is the complex, that means the primary infection in the lungs, and second on regional lymph node involvement. So it is one of the direct question that where the Gohn complex is found. The Gohn complex is found in case of the Mycobacterium tuberculosis.